Could something as simple as apple cider vinegar actually delay your dialysis by years? When I first heard this claim from a patient whose GFR climbed from stage 4 back to stage 3, I refused to believe it. So I spent 3 months digging through clinical trials and speaking with nephrologists, and what I found genuinely stunned me. There are 5 specific treatment goals that can reverse kidney decline, one vitamin most CKD patients are dangerously deficient in, and foods doctors rarely mention. Before we begin, tell me your age, your country, and your latest creatinine. I'll answer every question. Nobody tells you the truth about apple cider vinegar, and that silence is costing kidney patients their remaining function. Walk into any nephrology clinic and ask whether you should be using it. Most doctors will shrug, change the subject, or call it a folk remedy. Yet sitting on a shelf in nearly every kitchen is one of the most thoroughly studied natural compounds for controlling the 3 things that destroy your kidneys faster than almost anything else: high blood sugar, high cholesterol, and steadily rising creatinine. 1. Apple cider vinegar. The compound doing the heavy lifting is called acetic acid. When you drink raw apple cider vinegar, acetic acid enters your bloodstream and triggers something remarkable inside your cells. It activates an enzyme called AMP-activated protein kinase, often shortened to AMPK. Think of AMPK as the master switch that tells your liver to stop dumping sugar into your blood, tells your muscles to absorb glucose more efficiently, and tells your fat cells to release stored energy instead of clinging to it. For someone with kidney disease, every spike in blood sugar is another small injury to the delicate filtering units called nephrons. Calm the sugar, and you calm the damage. Researchers at Arizona State University, led by Dr. Carol Johnston, published a landmark study in Diabetes Care, the official journal of the American Diabetes Association. They gave participants 2 tablespoons of apple cider vinegar before a meal. The results were striking. Insulin sensitivity improved by 34% in people with prediabetes and by 19% in those already diagnosed with type 2 diabetes. That single number, 34%, represents the kind of metabolic shift most prescription drugs struggle to match. A separate clinical trial showed that 2 teaspoons of apple cider vinegar taken at bedtime lowered fasting blood glucose by roughly 4% within 12 weeks. Cholesterol numbers also moved in the right direction, with LDL falling and triglycerides dropping meaningfully. For kidney patients, this matters in a way most people overlook. Lower triglycerides mean fewer fatty deposits inside the small blood vessels of the kidney, which translates into better blood flow to whatever nephrons you still have. Here's where most online advice goes dangerously wrong. The wrong kind of apple cider vinegar will do nothing for you, and the wrong way of drinking it can actually cause harm. You must choose organic, raw, unfiltered, and unpasteurized apple cider vinegar. Hold the bottle up to the light. If you see a cloudy, web-like substance floating at the bottom, that is called the mother. The mother contains the live enzymes, beneficial bacteria, and trace minerals that give apple cider vinegar its therapeutic power. The clear, sparkling vinegar sold in pretty bottles has been stripped of all of that. It is essentially flavored water with no medicinal value. Here is how to use it safely. Take 1 to 2 tablespoons and dilute them in a tall glass of warm water. Never drink it straight, because the acidity will erode your tooth enamel and irritate the lining of your esophagus. Sip it through a glass or stainless steel straw to keep the acid off your teeth, then rinse your mouth with plain water afterward. The best window to drink it is 20 to 30 minutes before your largest meal of the day, usually lunch or dinner. This is when its glucose-lowering effect is strongest. If you are currently taking insulin or oral diabetes medication, please speak with your doctor first, because your dose may need to be adjusted. That brings me to the second food on this list, one with a quieter reputation but an even more impressive resume for your kidneys. 2. Spirulina. Spirulina is a blue-green microalgae that humans have been eating for over 1,000 years, going back to the Aztecs who harvested it from the surface of Lake Texcoco in central Mexico. Modern science has rediscovered why our ancestors prized it. The active compound in spirulina is called phycocyanin, the deep blue pigment that gives the algae its color. Phycocyanin is one of the most powerful natural molecules ever isolated for fighting inflammation and oxidative stress in the human body. For someone living with kidney disease, this is exactly the kind of help your body is crying out for. Chronic kidney disease at its core is a disease of inflammation and oxidative stress. Every single day, the surviving nephrons in a damaged kidney are bombarded by free radicals and inflammatory signals that gradually push them toward failure. Phycocyanin steps in and neutralizes those free radicals before they can do their work. It also calms the immune signals that drive the scarring process inside the kidney tissue. A clinical trial published in the Journal of Medicinal Food gave chronic kidney disease patients 1 gram of spirulina daily for 8 weeks. The participants showed measurable improvement in their glomerular filtration rate, often shortened to GFR, which is the single most important number on your kidney lab report. Markers of inflammation, including C-reactive protein, also fell significantly across the study group. Spirulina also delivers something most kidney patients are deficient in. It is loaded with bioavailable iron, calcium, magnesium, and the entire B vitamin family. If your hemoglobin has been drifting downward and you feel tired all the time, this is a piece of the puzzle worth addressing. There is something else subtle here that almost no article mentions. Spirulina contains tryptophan, the amino acid your body needs to produce serotonin during the day and melatonin at night. Melatonin is not just a sleep hormone. It is one of the strongest antioxidants your body makes on its own, and it concentrates inside the kidney tissue while you sleep, quietly repairing the oxidative damage you accumulated throughout the day. Take 1 teaspoon of organic spirulina powder, about 1 to 2 grams, mixed into a small glass of water or unsweetened juice in the morning. Start with half a teaspoon for the first week because some people experience mild detox symptoms in the early days. And here is what almost nobody connects to kidney health. You can eat every right food in the world, but if you are sleeping less than 6 hours a night, your kidneys are still losing ground. Poor sleep triggers the exact same inflammation and oxidative stress that destroys nephrons. In the next part, I will reveal 5 specific foods, including 1 fruit eaten 1 hour before bed that helps you fall asleep 42% faster, that work to rebuild your kidneys while you rest. There is one small detail about sleep that quietly reverses the entire trajectory of kidney disease, and most patients have never been told about it. You can take every medication, follow every diet, and drink every healing tea, yet still watch your numbers slide in the wrong direction. Why? Because every single night you sleep less than 6 hours, your kidneys lose ground that no food or drug can recover the following day. Here's what happens inside your body when sleep falls short. Within just 1 week of sleeping under 6 hours a night, your levels of C-reactive protein and interleukin-6 rise sharply. Those are inflammatory messengers that travel through your bloodstream and hammer at the fragile nephrons inside your kidneys. At the same time, your cortisol stays elevated, your blood pressure climbs at night when it should be falling, and your antioxidant defenses collapse. Researchers at Brigham and Women's Hospital, working with the Nurses' Health Study cohort, found that women sleeping 5 hours or less per night had a 65% higher risk of rapid kidney function decline over 11 years compared to those sleeping 7 to 8 hours. 65%. That is the cost of underestimating sleep. The good news is that nature has handed us 5 foods that can shift this entire equation, and they cost less than any prescription. Let me walk you through each one. 1. Banana. The first food on the list is the humble banana. What makes the banana so valuable for sleep is its rich supply of tryptophan, the amino acid your brain converts into serotonin and then into melatonin. A medium banana also delivers magnesium and vitamin B6, both of which your body needs to actually complete that conversion. Here is the part most people miss. A fully ripe banana with brown spots has a glycemic index above 60, which can spike your blood sugar and disturb the very sleep you are trying to protect. Choose a slightly underripe banana, where the peel is still firm and just turning yellow. Its glycemic index drops closer to 42, and it carries more resistant starch that feeds the gut bacteria responsible for producing calming neurotransmitters. Eat 1 banana about an hour before bedtime. For kidney patients, the potassium content matters, so please check with your nephrologist on how a banana fits into your daily potassium allowance. 2. Almonds. Almonds carry 2 ingredients your sleep deeply depends on. The first is magnesium. A small handful of almonds, about 23 nuts, contains roughly 76 milligrams of magnesium. Magnesium calms the nervous system by binding to GABA receptors in the brain, the same receptors that prescription sleep medications target. The second ingredient is naturally occurring melatonin, which most people are surprised to learn lives inside the nut itself. A study published in the Journal of Orthomolecular Medicine reported that regular almond consumption improved sleep quality scores in adults with chronic insomnia by close to 40% over a 4-week period. Eat 10 to 15 raw, unsalted almonds about 30 minutes before bed. Avoid the roasted, salted varieties, because the added sodium drives up your blood pressure and undoes the kidney protection you are working so hard to build. 3. Kiwi. Then there is the kiwi, the small green fruit that has turned out to be one of the most powerful sleep aids ever tested in a clinical setting. A team at Taipei Medical University ran a 4-week trial in which adults with sleep difficulties ate 2 kiwis 1 hour before bedtime. The findings were remarkable. Participants fell asleep around 42% faster, slept 13% longer through the night, and woke up significantly less often. Kiwis are loaded with serotonin, folate, and a wide range of antioxidants, which appear to work together to regulate the sleep cycle. They are also one of the lower potassium fruits in the tropical family, making them generally safer for kidney patients than many other options. Wash them, slice them in half, scoop out the flesh with a spoon, and eat them about 1 hour before lights out. 4. Goji berries. Goji berries are tiny red fruits with an outsized reputation in traditional Chinese medicine, and modern research has been steadily catching up. They contain melatonin, beta-carotene, and a class of antioxidants called zeaxanthin, which protects both the eyes and the small blood vessels throughout your body. A clinical study led by Dr. Hironobu Amagase tracked adults drinking a daily serving of standardized goji juice for 14 days. The participants reported an 80% improvement in their sense of sleep quality, along with reduced fatigue and a noticeable lift in mood. Soak 1 tablespoon of dried goji berries in warm water for about 10 minutes, then drink the water and eat the berries. The best time is roughly 1 hour before bed, and you can also add them to your morning oatmeal for the antioxidant benefit without affecting sleep. 5. Chamomile tea. Finally, There is chamomile tea, the soft yellow brew that grandmothers have prescribed for restless nights for centuries. The active compound here is called apigenin, a flavonoid that binds to the benzodiazepine receptors in your brain, producing a mild calming effect without the dependency risks of pharmaceutical sleep aids. A randomized clinical trial published in the journal Complementary Therapies in Medicine, conducted with elderly participants in Iran, found that chamomile extract significantly improved sleep quality and reduced symptoms of depression in adults over the age of 60. Steep 1 tablespoon of dried chamomile flowers, or 1 quality tea bag, in hot water for at least 10 minutes to fully extract the apigenin. Drink it slowly about 30 to 40 minutes before bedtime. When you weave these 5 foods into your nightly routine, you are not just falling asleep faster. You are giving your kidneys 8 uninterrupted hours of deep repair, which no medication on earth can fully replicate. But here is the hard truth. Sleep alone will not save you if your numbers are already in stage 4 or stage 5. In the next part, I will reveal 5 specific treatment goals, including the single laboratory marker that predicts kidney survival more accurately than GFR itself, that have helped real patients pull themselves back from the edge of dialysis. There is a strategy that helps badly damaged kidneys work better even at stage 4 and stage 5, and it has nothing to do with hoping for a miracle. The nephrology community has quietly accepted something most patients are never told. Once you cross into stage 4 or 5, the goal stops being recovery and shifts to something arguably more powerful, which is slowing the decline so dramatically that you may never reach dialysis at all. Patients who hit 5 specific treatment targets have walked back from the edge, sometimes buying themselves 10 or 15 extra years of kidney function. Today I will show you exactly what those 5 targets are. 1. Blood pressure control. The first target is keeping your blood pressure below 130/80 millimeters of mercury. Every time your blood pressure runs high, the small arteries feeding your kidneys push too much force into the glomeruli, which are the millions of tiny filters inside each kidney. Over weeks and months, those filters scar and stop working. The 2021 KDIGO guidelines, which set the global standard for kidney care, recommend an even tighter systolic target closer to 120 for most CKD patients when tolerated, based on the landmark SPRINT trial. That trial showed a 25% reduction in cardiovascular events and a slower rate of kidney decline among patients reaching the lower target. Measure your blood pressure at home twice every day, once in the morning before your medication and once at night, and write the numbers in a notebook to bring to every nephrology visit. 2. Reducing proteinuria. The second target is the single most important predictor of how long your kidneys will last, and almost no patient hears about it. You must drive your urine albumin to creatinine ratio, abbreviated as ACR, below 30 milligrams per gram. Protein leaking into your urine is not just a sign of damage. It actively poisons whatever nephrons you have left, accelerating the scarring inside your kidney tissue. The DAPA-CKD trial, published in the New England Journal of Medicine, showed that dapagliflozin, a medication from the SGLT2 inhibitor class, reduced the risk of major kidney events by 39% in CKD patients. Ask your nephrologist about this class of medication and request a urine ACR test at every checkup, not just an eGFR. 3. Treating complications. The third target is recognizing that stage 4 and 5 kidneys quietly create 4 complications that will silently push you toward dialysis if you ignore them. The first is anemia, which develops because failing kidneys stop producing erythropoietin, the hormone that tells your bone marrow to make red blood cells. Your hemoglobin should ideally stay between 10 and 11.5 grams per deciliter, often requiring iron supplementation or injectable erythropoietin-stimulating agents. The second is high phosphorus, which calcifies your blood vessels and your heart valves. Phosphate binders taken with meals are usually necessary once your phosphorus rises above 4.5 mg per deciliter. The third is metabolic acidosis, where your blood becomes too acidic because your kidneys can no longer excrete enough hydrogen ions. A landmark study by Dr. De Brito Ashurst in the United Kingdom showed that oral sodium bicarbonate, taken in small daily doses, dramatically slowed CKD progression in patients whose bicarbonate levels were low. The fourth is high potassium, which can stop your heart without warning, requiring careful dietary management and sometimes a binder medication like patiromer. For diabetes control. The fourth target applies to every patient whose kidney disease was triggered by diabetes, which describes roughly half of all CKD cases worldwide. The hard truth is that you cannot protect your kidneys while your blood sugar stays elevated. Every glucose spike pushes more sugar into the filtering membrane and creates advanced glycation end products that destroy nephrons one molecule at a time. The American Diabetes Association recommends an HbA1c target around 7% for most CKD patients, although your nephrologist may set a slightly higher number if you are elderly or prone to low blood sugar episodes. What most patients do not realize is that type 2 diabetes can be partially or even fully reversed through low carbohydrate eating, daily walking, and structured weight loss. The direct trial in the United Kingdom showed that 46% of type 2 diabetics achieved full remission through weight loss alone, with no medications at all. 5. RAS system medications. The fifth and final target involves a class of medications that work directly on the hormone system controlling your kidney pressure, called the renin-angiotensin-aldosterone system, or RAS for short. ACE inhibitors, such as lisinopril, and angiotensin receptor blockers, such as losartan and valsartan, relax the small efferent arteriole inside each glomerulus. This lowers the pressure inside the filter itself, which protects the delicate membrane from further scarring. The RENAIL and IDNT trials, both published in the New England Journal of Medicine, demonstrated that these medications reduce the risk of progressing to end-stage kidney disease by roughly 16 to 23% in patients with diabetic kidney disease. These drugs must be prescribed and monitored by your nephrologist, because they can raise potassium and require regular blood work, but for the right patient they can extend your kidney lifespan by many years. Now here's the part that requires the most attention, because it ties directly back to target number 2 on this list. Lowering the protein in your urine is not only about prescription medications. Nature offers 4 specific foods that have been shown to reduce proteinuria significantly when combined with a thoughtful dietary protocol, including one seed that drops both creatinine and urine protein at the same time. There is also a newly approved medication called finerenone, brand name Kerendia, that has cut proteinuria by more than 30% in clinical trials, and most patients have never heard of it. I will walk you through every one of these in the next section. The method that helped one of my elderly viewers stabilize her proteinuria in just 4 months is something most patients have never been told. She started with a urine ACR of 480 mg per gram, which is roughly 16 times the upper limit, and she was terrified that dialysis was only a year or 2 away. By the time she reached her next nephrology appointment, that number had dropped below 110. Her nephrologist asked what she had changed. The answer was a quiet combination of 4 foods, 1 dietary shift, and 1 new medication that most patients in her position have never been offered. Let me walk you through each piece. 1. Flax seeds. flax seeds may be the single most underestimated food for anyone fighting proteinuria. The active compounds inside are alpha-linolenic acid, a powerful plant-based omega-3, and a class of polyphenol called lignans, particularly one named secoisolarisuresinol diglucoside. These compounds calm the inflammation inside damaged nephrons and reduce the oxidative stress that drives protein leakage in the first place. A clinical study at the University of Western Ontario, led by Dr. William Clark, gave patients with lupus nephritis 30 grams of ground flax seed daily for 1 year. The participants showed a significant drop in proteinuria along with improved creatinine clearance. Grind 1 to 2 tablespoons of whole flax seed fresh each morning, since flax meal loses much of its potency once exposed to air for more than a few days. Stir it into warm oatmeal, yogurt, or a small glass of water about 30 minutes before breakfast. 2. Ginger. Ginger is the next quiet hero, and it goes far beyond settling an upset stomach. The active compounds inside fresh ginger root are called gingerols and shogales, and they work through several mechanisms at once. They block the inflammatory enzyme COX-2, which is the same target as many prescription pain relievers, but without the kidney-damaging side effects. They also improve insulin sensitivity and lower blood pressure modestly. Research published in the Iranian Journal of Kidney Diseases found that patients with diabetic nephropathy who consumed 2 grams of ginger powder daily for 10 weeks saw measurable improvements in their kidney markers. Slice 3 to 4 thin pieces of fresh ginger, steep them in hot water for 10 minutes, and drink 1 cup with lunch or dinner. Avoid ginger if you are taking blood thinners, because it has mild anticoagulant properties. 3. Brazil nuts. Brazil nuts hold a secret that almost no other food in nature can match. They are the richest natural source of selenium on the planet, a trace mineral that powers one of your body's strongest antioxidant enzymes, called glutathione peroxidase. Most kidney patients are quietly deficient in selenium, and that deficiency accelerates the oxidative damage already happening inside the glomeruli. A single Brazil nut delivers around 70 to 90 micrograms of selenium, and the daily requirement for adults is roughly 55 micrograms. Eat just 2 Brazil nuts per day, no more, because excess selenium becomes toxic and can cause hair loss and nerve symptoms over time. 2 nuts in the morning, chewed thoroughly with breakfast, is the safest and most effective dose. 4. Chia seeds. Chia seeds round out the food list and bring something the others do not, which is soluble fiber paired with another rich dose of plant-based omega-3. The combination forms a gel inside your digestive tract that slows glucose absorption and quietly lowers the inflammatory load reaching your kidneys. Soak 1 to 2 tablespoons of chia seeds in half a glass of water for 15 minutes until they form a soft pudding, and eat them in the morning or as a light evening snack. Soaking is not optional, because dry chia seeds can absorb fluid in the throat and cause discomfort, particularly in older adults. Beyond these 4 foods, the dietary shift that matters most is reducing your animal protein intake. The DOKI Nutrition Guidelines, published jointly by the National Kidney Foundation and the Academy of Nutrition and Dietetics, recommend 0.6 to 0.8 grams of protein per kilogram of body weight daily for CKD patients not on dialysis. For a person weighing 60 kilograms, that translates to roughly 36 to 48 grams of protein per day, with a heavier emphasis on plant proteins from beans, lentils, and tofu, which create less filtration pressure inside the kidneys than red meat or even chicken. Finally, there is one new medication that most patients with diabetic kidney disease have never heard of, even though the FDA approved it back in 2021. It is called finerenone, sold under the brand name Kerendia. The Fidelio-DKD trial, published in the New England Journal of Medicine, demonstrated that finerenone reduced urine albumin to creatinine ratio by 31% in patients with diabetic CKD, and it also lowered the risk of kidney failure and major cardiovascular events. Ask your nephrologist whether you are a candidate, particularly if you are already taking an ACE inhibitor or ARB but your proteinuria stubbornly refuses to come down. There is one last piece of the puzzle that almost every kidney patient gets wrong, and it has nothing to do with food or medication. Most CKD patients are dangerously low in vitamin D, even when they swallow a supplement every single day, because failing kidneys lose the ability to convert it into its active form. In the next part, I will reveal the one prescription form of vitamin D your kidneys actually need, plus the 2 nutrients you must take alongside it to keep your supplement from quietly calcifying your arteries. A little known truth about vitamin D is quietly breaking the hearts of millions of kidney patients who believe they were doing everything right. They swallow their daily supplement, they spend time in the morning sun, they trust the bottle on the shelf, and yet their blood work keeps showing the same disappointing result. Vitamin D still low. The reason is not that you are taking the wrong dose. It is that your kidneys can no longer perform the one chemical step that turns the supplement you swallow into the active hormone your body actually needs. Here is what happens inside a healthy kidney. The vitamin D you absorb from food, sunlight, or pills first travels to your liver and becomes a storage form called 25-hydroxyvitamin D. That storage form then travels to your kidneys, where an enzyme called 1-alpha-hydroxylase performs a small but absolutely critical conversion. It turns the inactive storage form into calcitriol, the true active hormone. Calcitriol then regulates calcium absorption, parathyroid hormone, immune function, and the health of every nephron in your kidneys. When your kidneys fall into stage 3, 4, or 5, that enzyme begins to fail. The KDIGO Clinical Practice Guideline on Chronic Kidney Disease and Mineral Bone Disorders confirms that roughly 70 to 80% of CKD patients are functionally deficient in active vitamin D, even when their basic blood levels appear adequate. 1. Calcitriol. This is where the conversation must shift from supplements to prescriptions. Calcitriol is the prescription form of active vitamin D that bypasses the broken conversion step in your kidneys. It is sold under brand names such as Rockotrol in capsule form and is also given by injection during dialysis sessions. Doses are very small, typically 0.25 to 0.5 micrograms daily, because calcitriol is dramatically more potent than the cholecalciferol capsules sold over the counter. Studies published in the American Journal of Kidney Diseases have shown that appropriate calcitriol therapy reduces proteinuria, slows the progression of CKD, and lowers the parathyroid hormone levels that quietly destroy your bones over time. Please do not attempt to dose this on your own. Calcitriol must be prescribed and monitored by your nephrologist, because it can raise calcium levels dangerously if used incorrectly. 2. Vitamin K2 in the form of -7 Malawian kwaches. Now here is something that almost no doctor explains when they hand you a vitamin D prescription. The moment you begin any vitamin D supplementation, you are increasing your body's ability to absorb calcium from food. The question becomes where that calcium ends up. If you take vitamin D without vitamin K2, much of that absorbed calcium can deposit inside the walls of your arteries instead of inside your bones. This process is called vascular calcification, and it is the leading cause of death in CKD patients. The Rotterdam Heart Study, which followed over 4,800 adults for a decade, found that those with the highest dietary intake of vitamin K2 had a 50% lower risk of dying from cardiovascular causes compared to those with the lowest intake. Look specifically for the -7 Malawian-Quatches form, which stays active in your bloodstream for over 72 hours. A daily dose of 100 to 200 micrograms taken with a meal containing some fat is the standard starting point. 3. Magnesium. The third piece of this puzzle is a mineral that gets almost no attention in kidney clinics. Magnesium is a required cofactor for nearly every enzyme involved in activating, transporting, and using vitamin D inside your body. Without enough magnesium, even a perfect dose of vitamin D simply cannot do its job. Research published in the Journal of the American Osteopathic Association estimates that up to half of all adults in industrialized countries are deficient in magnesium, and the deficiency rate climbs even higher in CKD patients due to medication interactions and dietary restrictions. Choose magnesium glycinate or magnesium malate in a dose of 200 to 300 mg in the evening, because both forms are gentle on the stomach and quietly support deeper sleep. Avoid magnesium oxide, which is poorly absorbed. Please check with your nephrologist before adding magnesium if your eGFR is below 30, because magnesium excretion becomes less efficient in advanced CKD. When you bring together everything we have walked through today, the picture becomes clear. The foods that protect your sleep, the seeds that lower your proteinuria, the 5 treatment targets your nephrologist must monitor at every visit, and now the right form of vitamin D paired with K2 and magnesium. These are not isolated tricks pulled from the internet. They are layers of protection that, when combined with close medical follow-up, have allowed many patients in stage 4 and stage 5 to postpone dialysis for 10, 15, sometimes even 20 additional years. Your kidneys are listening to every decision you make. Every meal you eat, every supplement you swallow, every hour of sleep you protect, every blood pressure reading you record. Treat them with the respect they have always deserved, and they will reward you with more good years than any prognosis on a clinic chart can predict. Thank you for staying with me to the end of this video. Drop your latest creatinine and eGFR in the comments, and I will personally respond with the next step that fits your specific situation.